This is Jessica DeMassa at the HISA Studio here at HIC 2017, and I'm with Damian. Damian, can you please introduce yourself for everyone watching?
Damian Claydon-Platt. I'm the Chief Clinical Information Officer at Epworth Healthcare in Victoria.
Okay, so talk to me, Chief Clinical Information Officer, and that's different than a CIO. How?
Yeah, well, being a clinician background, I work closely with the CIO to ensure that the IT systems that we're putting in for clinicians, whether that be medical, nursing, allied health, actually meet their needs. It's really important that there's an interface between the IT, the business side of healthcare and the clinicians so that we're all on the same page. So I really play a translatory role at the nexus between those three parts of the organisation.
Oh, that is a big role to take on. So what is keeping you up at night right now?
Silos of information. As a
Okay.
clinician, whenever I see patients, I always see them in an acute setting, but there's always a story before they come to me, and there's a need to communicate with people once they leave,
Right.
whether it be with the GPs who send them in, the specialists who refer them to our hospital, or passing it on to another healthcare provider. It's still really difficult to share information across all of those providers, and if we can't do that well, it really undermines our ability to enable continuity of care.
Do you have any thoughts on what needs to be done to overcome that?
Yeah, well, it's a multifaceted problem.
Right.
We have internal IT systems that don't talk well, but we also have troubles between our organisation and other organisations in the state and also at a national level.
Sure.
So I'm working internally, but I'm also working at the Department of Health level and also trying to talk to people like HISA and the societies, but also at a national level to try and address issues at all those levels so that we can put in the right infrastructure, the right frameworks, the right supporting technologies, if you like, the foundations to enable us to do those things.
If you could wave a magic wand and get rid of some of the barriers that are kind of keeping that information stuck in its own little silo, tear those walls down, what would you get rid of?
Oh, I'd probably try and enable secure, interoperable sharing of information.
Okay.
And that's the biggest problem that we have. So getting something out of Monash to us or us back to the Royal Melbourne is still so difficult. And I've been working towards this for the last 15 years and it just doesn't happen fast enough, even though I know that it's not always just the technology. Sometimes it's logistics, sometimes it's politics, sometimes it's funding.
Right.
And there's a lot of moving parts, but I'm really excited this year at HIC that there's so much traction. We seem to kind of be getting a lot of momentum now, moving in the right direction, and it's good to see a unified digital strategy from a national level. And a lot of the states are starting to pull together and realise that these foundation pieces need to be in place.
Do you think that this is a moment here where healthcare is going to start to transform more quickly? I mean, it seems like one of the things we've been hearing here in the studio is that the pace of change is kind of happening more rapidly and people seem ready for it. What are your thoughts?
Yeah, well, there's certainly a lot of clinicians that are ready for it. At the coalface with my colleagues, a lot of them are cautious about big systems, electronic medical records. There's a lot of concern, really driven by what they hear what's going on in the States, in the UK. But if you talk to them about what they actually need to do their job, if you talk to them about information, then they're all for it. They all want more information to look after their patients, to do research, to do audits, to do registries, and to enable that continuity of care. So we're trying to change the conversation away from, well, what's the system, the silver bullet that's going to fix all your problems,
Right.
to, okay, let me understand your information needs, and then we'll work out how we can mitigate or meet some of those or all of those needs. And it won't be a single solution, but understanding that information flow, I think, across the healthcare continuum is what's really important.
Well, Damian, thank you so much for sharing your perspective. We hope the next 5 years go a little faster than the last 15 and that the traction kind of continues to accelerate the pace of change. Thanks for joining us in the HISA studio. This is Jessica DeMassa at HIC 2017.